great to be number one. So, I'm Jungdae, I'm from 5AM Solutions, and I just wanted to talk to you about tissue. It seems to be a theme today, everyone's talking about it. Really, I think we live in a really exciting time right now for medical science. We're finding cures and treatments for diseases that we thought were incurable even a couple of years ago. This is a really exciting time for us. And at the core of all of this medical discovery is tissue, biospecimens. Because when a researcher has an idea and they want to research this idea for a cure that they have and figure out if this is going to work or not, they need to have access to the tissue in order to perform that research. Sometimes the tissue that they need is very rare and it's hard to find. And as a researcher, when they have this idea and they really want to pursue it, what do they do? Where do they go to find this information? I mean, really, it's very hard. You know, researchers at an institution typically just know people, know that within their own institution they're collecting specific types of tissues. They can find that there, but outside of their institution, they don't know. On the other hand, you have all of these hospitals, and they're performing procedures every day, saving lives. And they're collecting these specimens and these tissues, and they're storing them. And they, on their hand, don't have any way of getting this information out to the public, to the research community at large, so that they know that these things are available, that they can actually get access to these to advance medical science. So what you have here is an information barrier. And what's interesting here is that that's actually a problem that IT can solve. So what you see here is what we've created in order to solve that problem. What I like to think of this as is sort of like the Match.com of biospecimens and researchers. You know, I mean, I was lucky enough to meet my husband at work illicitly, and I would have that opportunity. I would get lost to see where to find a man. You know, where do I go? And you know, at that point, I would go to Match.com. I mean, it's great. I can put in all my specifications and find exactly the kind of man I want to meet. You know, I can do that. But when you're a researcher and you look for biospecimens, what do? So we created BioLocator, the Match.com kind of thing for health IT. And what you have here is basically a virtual locator. And so this is how it works. You have each hospital has their inventory of biospecimens, and we basically import their de-identified data into our system. Researchers, on the other hand, can go ahead and come to our system and go ahead and search that inventory, specifying exact criteria for what they want and find what they need. Basically, the system also facilitates the review and approval process because, as you know, biospecimens, it's not like Amazon.com where you can just go and order something and just get it out. I mean, this is important stuff. Some tissues are very, very rare, and you want to make sure that the right review processes are in place, that IRB reviews are done, and things like that. And so, recognizing that, we have a system in place to allow for review. I'm getting the 2-minute finger, so I'm moving forward. So it allows for order processing as well as shipping and tracking, so you always know where the tissue is located, and then the researcher can come back and put in input about the quality of the tissue that they receive. As the goal of this was also to make sure that the information got out to as large of an audience as possible, the system also integrates directly with the CA-BIG system, the NCIC grid. So let me move on quickly. Basically what you see is that a lot of people have identified that this is a need that they have. And so I just wanted to show you some examples very quickly. At the very back slide that you can barely see is the National Foundation for Cancer Research. They basically identified a need where they were collecting very rare tissue from China. It's very hard for folks here to get access to. And so they created a tissue bank in China, and so we're using our system to have to let pharmaceutical companies in the U.S. get access to those. NBS-TRN, that is newborn screening, and what's unique about that is that every child in the U.S. gets newborn screening. And so what's wonderful about that is that if you have a system like this that's collecting all that data for all of the United States, you can do a public health research and you can see what's going on there as well. So that's from NBS-TRN. ADRC is Arizona. They have very interesting tissue, Native American tissue. They have a large Native American population. They also have an elderly population, also Alzheimer's disease and things like that. And they have a large Hispanic population as well, so they're getting all of that out to the community. And really, that's it. And I think I'm within my 5 minutes. And I want to say thank you very much. And if you have any questions or